Hi everybody, I'm Dr. Roth. Good luck on your upcoming OCE2. Okay, so this time we're gonna make a little bit of a video to practice the simulation. So I am going to review the late talker simulation on day 3, or if this is used for another time, just the late talker simulation. So I'll review the case study, and also I'm gonna just take my glasses on and off, like kind of like a Clark Kent thing, to distinguish between the SLP and the patient. So let's see how this goes. But either way, I am going to act as the SLP and give you examples of how to act as the specialized patient. Okay, let's start. Here's the scenario. All right, for the SP, you are the parent of Liam Martinez, your 33-month-old son, whom you have brought to a local speech and language clinic for an evaluation. You are concerned about his delayed speech. The SLP has already conducted all the evaluation activities that were planned, but is coming back into the room to complete one more task, a checklist for behaviors that help to determine whether a child is likely to have autism. The idea that Liam might be autistic has never crossed your mind. You do have concerns about his language development, but otherwise think he's ingenious. All right, let's get started. So I'm going to enter the room as the SLP with my glasses on, and then I am going to react as the parent or SP with my glasses off. All right, hi, Miss Martinez. We finished the evaluations, but we want to do one more screener. So, how do you do? Well, we got a lot of great information on Liam's speech and language, but we want to learn a little more about his social skills. To do this, we're going to use something called the MChat. The MChat helps us to check for behaviors that could be an indication of autism, but not necessarily. It is just a screener. Wait, is my child getting diagnosed for autism right now? No, this is just a screener. It is not for a diagnosis. Also, the MChat is just a screener to look for possible characteristics of autism. It does not diagnose. However, it will help us to determine if you should pursue additional assessment for a formal autism evaluation, which could give you a diagnosis or deny the presence of autism. We always like to screen for autism when we have concerns because the research states that the best intervention is early intervention. Oh, okay. This is a surprise. Yeah, but I think I understand. Yeah, I guess let's do it. All right, so now we're just going to ask a series of questions. There are 20 questions. If you point across the room, does he look? Not really. I usually have to walk him over to it. Okay. Have you ever wondered if your child might be deaf? Yes, I mean, sometimes I really wonder because he just ignores everything I say. Okay, so here is where you can also insert the additional 1 to 3 questions to ask for additional information while responding to the MChat. This will give the SLP an opportunity to clarify and allay any concerns. Does your child do any pretend play? I actually don't know what that question means. Could you give me an example? Sure, no problem. So pretend play could be like holding a baby doll and like feeding him or trying to give him food. Or maybe they take their car, but instead of just rolling it, they might pretend like they're driving through a city and make vroom vroom sounds. Does he do anything like that? Oh, no, he doesn't do anything like that. He really just spins the wheels and looks at it. Okay, so on and so forth. And you will continue to answer the 20 questions for that. Okay, So next, the SLP will discuss the results of the language example assessment as well as the MChat. Okay, thank you so much for answering that MChat. So let's just talk about some general overview things and begin to talk about next steps. All right, so he did present with a moderate speech delay, or sorry, excuse me, a moderate language delay, but we did also notice some red flags for autism. On the MChat, we normally start to have concerns of possible autism if you answer no to 3 or more questions on the MChat, and he answered no to 7. So I do think at this time it would be best to recommend a formal medical assessment of autism. And we want to do this because we just want to make sure we have the most information about Liam so that we can figure out how to design his educational plan the most with, setting him up for the most success in the future. Okay. I mean, I'm not surprised about the language because he definitely seems to have issues with that, but I mean, are you saying like you really think he has autism? Like, is it severe? I actually just think he kind of looks like his brother, so I never really thought that he had any differences. What we should do is we're going to think about just using the information that we have right now. So we do know that, there's a likelihood of there is probably a moderate language delay. And again, we'll probably score those and go over those in detail next week. We cannot definitively say if he has autism or not, but it is always best to check. So since he did kind of come up as significant on 7 of the questions, I think it is best for future therapy and educational planning just to go ahead and get that autism assessment. That way we'll know for sure if he has it and we'll know how to plan accordingly. Okay, yeah, this is a lot, but okay, that makes sense. All right, so let's talk about next 3 steps. So first, luckily, you're with us, so we can go ahead and get speech therapy started right away. So we'll schedule an appointment next week for you to come back to review the evaluation results for the speech and language portion thoroughly. And also, we do not need to wait for your autism diagnosis to come back. We can already start working on some of those social skills now. All right, so we'll review your evaluation and also maybe develop a therapy plan going forward. Next, you're also going to want to contact your pediatrician. Just let them know that your son failed an autism screener. Again, this is just a screener. This just indicates the need for additional assessment. And let your pediatrician help to guide you through the medical model of trying to find someone who can provide an autism diagnosis or an assessment or rule out the diagnosis of autism in your community. And thirdly, I would just like to clarify that there are specific people in the community who can provide that autism assessment for you. So first, for the medical assessment, you're going to want to find a child psychologist or neurologist, child neurologist, to help do that formal medical assessment. That is really important because that can help you to first find out if he definitively does have autism or not, but also if you have that medical diagnosis, that makes you eligible for accessing insurance-based services such as ABA or other therapeutic supports. Another thing you're going to want to do is try to get an educational diagnosis. Now, since he is 2.5, you can go to the early intervention program in your area. These are state-run organizations, and you can get an educational assessment for the possibility of autism as well as speech and language. And this will help to get you free preschool, early intervention, or school-based services. And then if you were to have an older child, such as preschool or school-based, you would just go ahead and get this educational diagnosis done at your preschool or school. I know this is a lot of information. Does all this make sense? It does. Thank you for providing additional information. I might have more questions going forward. Yes, I'm sure that will be the case, and absolutely feel free to reach out anytime. I'm happy to re-clarify and help you however I can. Okay, but for now, that's it. That's the end of the evaluation. Do you have any additional questions for me? I'm still really worried about the possibility of autism. Do you think this is going to like affect his ability to go to school? Now remember, the SLP needs to stay in their scope of practice and they cannot make future recommendations. Anytime there's a possibility of a new diagnosis for any sort of medical condition or disability, it is concerning. But you know, we don't want to make future projections at this time. And also, as soon as if we can find out soon and go for early intervention, there's really good research showing really good outcomes. So while we can't make future projections of how he will do, we do know that early intervention is incredibly helpful at giving kids the best opportunity at meeting their fullest potential. But I think you're in a good place. You're already here at receiving speech and therapy sessions. It sounds like you have a great pediatrician, and we have a lot of great members in the community who can help you find out more information about this possibility. Does that sound good? For now, yeah, I guess. Okay, thank you so much for coming in. It was so nice working with you, and please do not hesitate to ask other questions. I would love to help you with this issue as well as any of your speech and language concerns going forward. See you next week.